Hello and welcome to Insight, everyone. I'm Nnamdi Odipo. Today we discuss the potency or the lack of it of drugs sold in Nigeria. And I'm talking about countless medications that have failed to provide the therapeutic effect that they are primarily produced to offer, leaving patients vulnerable, untreated, and oftentimes at the risk of worsening conditions. How many lives are silently endangered by drugs that look genuine but they lack the necessary active ingredients? Besides NAFDAC, who guarantees the safety and efficacy of what patients consume? Is NAFDAC even doing enough? Well, these are some of the questions and issues that we will be getting deeper and clearer insights on. And then we'll also discuss journalism on a whole new level. I mean, with 21st century practitioners having the opportunity to leverage advances in ICT to enhance media content, I beg your pardon. Let's begin now.
Whatever the issues are,
the National Assembly is constitutionally empowered to scrutinize,
however complex or intricate.
We have involved all the academia, the members of the academia. We have involved the academies.
Be it government policies or in fact any issue of public concern.
Our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of agreements in terms of who has been in power longest and who becomes the governor of the state.
It's also in the quality of food being consumed.
After all, perception is insight.
And gaining understanding is also getting insight.
All right, so we'll begin our conversation basically talking about what the issue is. It does appear like public trust in medicine, or should I say the efficacy of medicines in Nigeria, is fast eroding. And I'm talking about the integrity of drug safety, quality control and patient protection being constantly threatened by lapses, whether they are regulatory or corporate. In fact, some have said that as far as the matter is concerned, these lapses that I've talked about are fallouts of larger societal and systemic challenges. While I suspect that to be closer to the truth, I think I best let my guests give us a clearer insight, or perspectives on the nature and structure of the problem and, of course, the way forward. My guest is Dr. Abubakar Danraka. He's a pharmacist, consultant, health sociologist, and public analyst. I should also state that Dr. Danraka is also a drug production and quality assurance specialist. He joins me via Zoom from Cairo, Egypt, for this conversation. Doc, I'd like to thank you so much for coming on the program. It's good to have you here.
Thank you very much, Nnamdi. It's a pleasure to be here. Good day, listeners and viewers.
I should also inform my guest that Dr. Danraka is also a fellow West African Postgraduate College of Pharmacists. So he is overqualified, I should say. I mean, not to understate his qualification. He is typically qualified to talk about this issue. Dr. Danraka, I don't know how long ago you left Nigeria, but if you were around when there was this recent outcry from one of the Nollywood actresses in Nigeria, but this particular one was Nkiru Njoku. She exposed the ineffectiveness of a popular anti-diarrhea drug in treating a severe stomach ailment at the time. It went viral at the time, and so it sparked public outcry. First, and in getting your perspective on this issue, first, do you think our experience is isolated and she may be crying wolf? Otherwise, it becomes an attestation of a disturbing trend of substandard and said medicines flooding the Nigerian market. Dr. Danraka, as a public health, crisis, doesn't this situation amount to a state of emergency, especially with accounts of countless medications failing to deliver promised therapeutic effects, leaving patients vulnerable, leaving them untreated, and oftentimes at risk of worsening conditions? Am I understating the situation, overstating the nature of the drug safety challenge that we have right now in Nigeria?
Thank you very much for that question. and also the discourse you have raised. Indeed, the issue of drug safety, which alludes to pharmacovigilance,
Vigilance.
is key. Yes, pharmacovigilance is key. We call it in the technical term pharmacovigilance. And to explain it further is just to talk about medication safety, drug safety. Indeed, I must say, I just traveled out of Nigeria recently, not up to 10 days, just on private vacation on my annual leave. It's good to rest after a lot of work and come back refreshed to keep adding value to our services we render in the
And I hope you're having a
country.
good rest.
Very good rest, indeed. So the issue you mentioned is isolated per se, but because of the nature of the person making the reporting, maybe that's why it went so viral. And it is important to note that the recent actions by NAFDAC also speaks to the dire situation we are in with respect to substandard and fake medications in Nigeria. You recall, not up to 2 months ago, NAFDAC did a backed action across the country with the support of the National Security Advisor, just to get rid of such tons and tons of fake and adulterated medications in Nigeria. I must say that you have not understated the problem. Rather, you have just been conservative, because a lot of literature and studies are showing that the prevalence of substandard and adulterated medicines in Nigeria is as high as 26. Some studies are mentioning quite above that, but with verifications, I feel the 26 to 30% is very okay to leave it at that, which is far above the WHO recommendation of about 5% or thereabouts.
And so when you say it's quite a dire situation in Nigeria, I mean, there are plenty of examples. And I'm glad you've said and you've confirmed that Njoku's case or incident is not an isolated incident, because today we even see trusted brands failing. And then we wonder how these adulterated drugs still manage to get into the markets and into the pharmacies in spite of NAFDAC's efforts. Yes, you've talked about what NAFDAC, or rather you alluded to what NAFDAC does in terms of, pharmacovigilance, But let's talk on some of the dire consequences of this trend. Today we see doctors lamenting over issues like prolonged illness, over issues like antibiotic resistance by some patients, and in some cases, death. Are there, Dr. Danraka, are there perhaps stages in terms of usage of fake and adulterated medications that can cause deterioration in the health of a patient who uses them, of course, or perhaps in ignorance? Say, for instance, and I'll give an example. A patient uses an expired drug, I should say. Does that patient get the same or a similar reaction when he or she uses a drug with more active ingredients, or perhaps a drug mixed with chemical pollutant? How do these deterioration start, or what reaction do you get depending on whether you take a drug mixed with chemical pollutant, a drug with higher, more or increased active ingredients, or under active ingredients, depending on what the situation is? How does this deterioration of a patient's health begin?
Okay, thank you very much. I think it's good, as we say in most of the classical studies, to start from known to unknown. What is known is actually that a potent drug, which has good quality, has a life cycle. That is to say, a potent and good quality drug should serve its purpose when taken correctly, because it should have its active ingredient that is of the optimal dose and also maintained in the distribution chain to get to the patient. So let's start from that. That is, this is a product which is known and is also of good quality. Now, let's juxtapose it with what is the fake or substandard product. it is important for our viewers to note that what makes the drug substandard or fake, it's its failure to comply with expected standards and compliance with the regulatory guidelines of production and storage. That is to say, this fake drug, it's fake because it has not passed through due licensure by the regulatory body, in this case, NAFDAC in Nigeria. Then the second aspect is, as you said, it might have been exposed to other conditions outside the manufacturer's guideline, that is exposed to sunlight, kept under rain, or exposed to humidity, which are all factors that affect its potency and they impair on the availability of the active ingredient. So at the end of the day, it's not only expired drug that is a problem, even the non-expired drug that has not been kept properly will also have lost its potency. So let's come back to how the deleterious effects take place. So now, normally when you take a good drug, it will have a good bioavailability. It releases the active ingredient in the system once consumed, either through oral means or through injectable. It now gets to the receptor site and elicits its action, which is the physiological function you see. If it is an antibiotic, it targets the microbes, acts and eliminates them. Or if it is something that affects some physiological functions, either to elicit vasodilation or vasoconstriction, as the case may be, that will happen. In the case of fake drug, what happens is that because it is already not having the active ingredient due to the exposure to those factors that harm it or degrade it, there is actually no physiological action. That's the best case scenario of a fake drug.
No reaction
you just
at
take
all.
It, no reaction, no effect. That's the best case scenario. But in most cases...
So you keep taking the same drug if a patient in this case, and still on this scenario that you've painted, the patient keeps taking this same drug, like in Joku's case, where she had to take 5 pills of the same drug and did not feel anything.
There won't be effect. Yeah, there won't be any effect. That's the best case scenario, because the only thing is that there won't be any clinical improvement. Maybe if the person does not see any effect, he might go to another doctor or another pharmacist and get a better drug, or as the case may be. But the other worst case scenario of a fake drug is when the faking or the substandard is in contamination, as you mentioned, pollutants. If it is a case of is chemical pollutant or a contaminant that makes it to be fake, which is completely not what it is on the label. For instance, it's supposed to be paracetamol, but what is inside is actually not paracetamol, rather is a toxic active ingredient that is put together to make paracetamol tablet, then there is a problem. Because that one will lead to toxicities and harm to other vital organs of the body. The other third case scenario is where it is actually the drug, the identification is there, but it's suboptimal dose or above optimal dose. If it is suboptimal, it will lead to what we call antimicrobial resistance, because you will take the antibiotic and it will not kill the microbe, and at the same time, the microbe will have been exposed to the agent and will have developed resistance, so that when you take the correct dose, it will not give the action it's supposed to. So in all scenarios, it leads to prolonged treatment failures. It leads to high cost of medications and loss of trust in the entire healthcare system. And it also leads to adverse reactions, as well as mortality in some cases, because sometimes some of the pollutants are actually highly poisonous. They could be lead, they could be some of these poisonous and toxic elements that are not supposed to be ingested in such quantities.
And yes, we have regulations and we have regulatory bodies in place. I mean, we've mentioned NAFDAC here time and again. We do also have the Pharmacist Council of Nigeria, which I'm sure you're a fellow of one of the institutes. You know, I know for starters, I know for one that what NAFDAC does essentially is to ensure some of what you've just talked about, you know, good manufacturing practice regulations. And it also does this market surveillance as well.
Surveillance, yes,
Just
PMS.
yes, that's the amalgam of the
Mandate, yeah.
pharmacovigilance that it does.
Yeah.
Doc, you wanted to say something? You can come in.
No, go ahead, please. Go
Yes.
ahead.
So
Let me
I
allow you
also
now.
wanted to say that I know, I don't know if that has changed, but NAFDAC used to have the Central Drug Control Laboratory somewhere in Lagos back in the day. I don't know if that has changed. But it used to serve as the official reference laboratory for quality control testing of medicines. You know, so if it does that, I mean NAFDAC now, and still does this post-market vigilance and all it's supposed to do in terms of pharmacovigilance, yet we see lapses in the market. We see, you know, these gaps that exist, purely and clearly exist in the pharmacovigilance by NAFDAC. Do you think the agency is perhaps overwhelmed and that government may need to, at this point, rethink strategy in terms of quality assurance strategy?
Thank you very much for that wide perspectives you have raised. But indeed, the issue of drug safety and concern in the context of our discussion is actually far beyond only NAFDAC.
I know,
Because
and I agree. Because you
Yeah.
and I, down the line, will talk about stakeholders' role. But now,
Okay, that's
I
fine.
am pinning you down on the issue of, of
Yeah.
regulatory lapses. Because, of
Yes,
course, like I said at the
mm.
beginning, we will talk about
Yeah.
regulatory lapses. We'll talk about corporate negligence.
That's
By
fine,
even
that's
the,
fine.
by even the producers, the manufacturers, and of course, we will talk about the larger systemic challenges, societal challenges
understand.
that exist. So for now, Doc, I would like your perspective on what you think should be done in terms of quality assurance and government rethinking its strategy when it comes to NAFDAC, or perhaps, rejigging the entire system as far as regulation and regulatory monitoring and enforcement is about in terms of pharmacovigilance in Nigeria.
Thank you very much. I think from my own experience and also from a lot of studies and literatures, what is important is to have participatory responsibility. What do I mean by participatory responsibility? The healthcare provider, our national drug policy speaks clearly to the responsibility of healthcare providers. Because the system in place in Nigeria, just as in any other country that is within our rank amongst the low and middle class in terms of developmental definitions, there is a primary care level, there is secondary care level, and there is tertiary care level. Our policies of the Federal Ministry of Health in Nigeria speaks clearly to secondary care and tertiary care providers should have independent testing laboratories in their facilities, which I must tell you from our assessment that is lacking. If it's not zero, but is extremely below acceptable level. I must tell you we are conducting a study trying to see what is the baseline of quality control laboratories in our tertiary hospitals and secondary healthcare facilities in Nigeria. Because our policies are very clear. The National Drug Policy, the National Quality Assurance Policy have spoken to if you have a secondary healthcare facility or tertiary healthcare facility, there is a minimum benchmark of guaranteeing, aside from the NAFDAC rule, as a healthcare facility, you have, when you collect your samples or you collect your supplies, you take a random sample and test in your laboratory so that you do a minimum identification and basic quality before you stock it. That is what we call test before you stock, which is lacking. So you can't just say it's only NAFDAC that should be held accountable, while our policies are very clear. Secondary healthcare facilities and tertiary healthcare facilities, federal health institutions, must have a quality control testing laboratory, which is lacking.
And I agree with you totally, Doc, completely. But isn't that the case when the product is already available and in the market? Because the health institutions, whether primary, secondary, or tertiary, cannot stock or cannot produce and stock. they source, and then they stock. So they are getting products from the manufacturers, products that, that they assume or would assume meet the requirement, as provided for by the regulatory body. But we're saying that at some point, along the value chain between manufacturing and when it gets to the institutions, that some of these lapses occur even at that point. Between the point of manufacturing to the point of disbursing to the market, making these products now available to the public. And that is where the role of NAFDAC comes in.
I agree with you. The NAFDAC, as you alluded to, has more than one reference laboratory. They have actually gone ahead to decentralize. They have a testing laboratory in Kaduna. They have in Enugu, and they also have in Lagos. So it's actually decentralized. And the purpose is to validate what the ordinary manufacturer or importer presents to the regulatory agency. It's good to give a perspective into how the system works. If you are to produce a product in Nigeria, it is expected you do a dossier, and the dossier will have the certificate of analysis of that particular product you are producing. If also you are importing, you will also have the dossier of what you are importing, the product, and part of the dossier is the certificate of analysis of that product. So what NAFDAC does is to collect your sample, collect your certificate of analysis, and also subject it to the test independently in their own reference laboratories. Once that is confirmed, they now give you the interim registration for 2 years. And after that, then they confirm taking samples, not the one presented by you in the market, and confirm it and also give you a final approval of your NAFDAC registration number. The system also recognizes that you should have independent laboratories in country, which is controlled by Institute of Public Analysts of Nigeria. And I must say here that that is also very lacking, because it might interest you that the country has less than 100 registered independent testing laboratories as we speak right now. What might even distress you more, I must say, is look at a whole center of excellence like FCT Abuja, where I reside. There are less than 10 registered independent testing laboratories.
Doc, you may have mixed it up. Doc, you may have mixed it up there. Lagos is the center of excellence. Abuja is the city of unity.
Center of unity.
So that you don't cause another war here. Oh.
That is very true. Center of Excellence has more than 80% of the testing laboratories as we talk. That is to say, 70 to 80 testing laboratories that are registered by the Institute of Public Analysts of Nigeria are within the Lagos-Ogun axis. So that tells you their need. We don't have testing laboratories in secondary and tertiary health facilities. Even the independent testing laboratories that should validate this quality of this product are lacking across the country. So that is the real picture, and it is a cause for concern. And no wonder, with our porous borders, you can see everything in the market, because I'm sure NAFDAC has informed us the tons and tons of products that were mocked up that were intended for consumption across the country. Over 10 trailers of fake and substandard products that were mocked up, that were ordinarily intended for the Nigerian market.
And Doc, I mean, from your analysis, I get a sense that in terms of what NAFDAC does, it does its bit, it does its part.
Very well.
So that for the drugs that passes through its laboratory, its center verification laboratory, these are certified as good original drugs with active ingredients, But yet there are those who circumvent the system, and then they do not go through these labs. And these are some of the drugs that NAFDAC, impounds time and again in some of these markets. We saw what happened last time at the market in Onitsha, I beg your pardon, and some other places in Nasarawa and some other places, of course. And then I also get a sense of what you mean, and that was what I alluded to earlier when I said rethinking our strategy. I did not even, and I mean, it's good now that I know that it's already there, independent, verifiable, existing labs to also
Yes.
complement, some of government or
NAFDAC.
public-owned, labs or laboratories by NAFDAC and
Yeah.
all of that to also help increase quality assurance for this. But like you did say, these labs do not exist. So we're not talking about, this is not, it does appear that this is not a function of making provisions or creating structure. It's actually a function of lack of implementation and seeing them
Very
through.
well.
So, I mean, who does that? Who is responsible for ensuring that this structure that has been put on paper, that should be regulation, should be there, and yet it's not there? Is it a function of government, or is it a function of the private sector not playing its parts now? What exactly are we getting wrong here, and how can we get it right?
I think what we are getting wrong, I must say, is the citizens' engagement to hold governments accountable. It is the key thing that is not there. You can see improvement in electioneering and electioneering process because a lot of our NGOs and civic societies focus on election. How many civil societies and non-governmental organizations do we have focusing on consumerism that hold government accountable to quality of medicines and quality of food that we take? We have the FCCPC, the Federal Consumer and Competition Commission, which has gone ahead to bring patient's bill of rights, which speaks to the rights of the patient and also what are the responsibility of patients and caregivers. Who enforces it? Is it not supposed to be the civil societies and me and you that are the middle class elite to talk and push government to spotlight, especially journalists? I must say, the NTA is doing its best, but it's not what is ought to be. It should be all the media houses to be having this.
That's why we're doing this, and that's why we're drawing.
Yes, I agree.
We're drawing attention to the issue.
Yes, I'm commending you. NTA has been on these platforms in different of your programs to highlight these salient points. So it's a call to action for our middle class and elite to ensure that there are civil society groups and non-governmental organizations that spotlight this holding government accountable. Indeed, on the government part, they need to put their acts together to have what is the Ministry of National Planning doing that is supposed to coordinate the activities of agencies and ministries and departments of government. Because there is a lot of operating in silo. You have a lot of agencies that ought to collaborate and support each other, but they rather try to work independently. And so I think that is what is lacking. We need to have citizens to hold government accountable to this enforcement of our laws. We have adequate laws. I have mentioned up to 4 different policies on this platform as we have started, but the enforcement is not there. Enforcement is not there. And who is to wield the stick?
The big stick.
It's the government. The big stick is the government, so that the person who is not ready to do what is supposed to be according to the books is shown the way out. We are, for goodness, there are 200 million Nigerians, have competent hands everywhere. I was shocked when I was in Cairo here. In all the health facilities I go, I see Nigerians, I see active Nigerians heading facilities, and it's unfortunate.
It's unfortunate. While it's amazing, it's rather unfortunate. You've raised some critical germane issues here, accountability, and wedding the big stick. We'll talk about that down the line. But like I said, you raised a couple of issues, and I consider them. I think I should talk about something that that reoccurred or kept reoccurring even as you spoke, and I think that's an underlying issue. Even though I get that this problem, that we have in our hands is not peculiar to us in Nigeria. As a matter of fact, drug counterfeiting has also entered, the global supply chain. I'm sure you know that drugs like antiretroviral medications, anti-malarias, antibiotics are frequently the main target of drug counterfeiters. And data, some of the data you even referenced there, show that, the rising cost of drugs, like you rightly alluded to, of these medications, and the lack of availability is also a major and key factors. So the thing is, do you then blame patients who, out of desperation, and perhaps poverty, cut corners to get medicines for maybe for their ailing relatives or even for themselves, mostly out of ignorance. Do you blame them for cutting or wanting to cut corners sometimes?
I will partly say yes and no. Why do I say yes and no? I will blame them because we have not seen them eat rotten food. So that is to say they still have their sanity to choose what kind of food to eat. So, and I would say no, because indeed, ignorance and poverty can make somebody to do what ordinarily he wouldn't have done. So that will be my response.
Dr. Danraka, I dare say we have had a robust conversation on this issue, having touched a bit of this and that as far as this issue is concerned. I know we've talked about consequences, impacts, and effects. We've talked about rejigging the system, improving pharmacovigilance, as it were. In fact, if we were to flip the pyramid in terms of pharmacovigilance and where it's supposed to begin, and say we flip the pyramid and we place the patient there, it will seem like the patient has a very key role to play in pharmacovigilance, just as much as the manufacturer, just as much as the regulator, and just as much as every other person in the value chain. Is that your submission as we conclude and wrap up this conversation?
Perfectly. The patient remains the fulcrum. The patient remains the focus of the entire concept of medication safety, drug safety, and patient safety. It is the patient and the patient caregiver that should be very vigilant in terms of reporting any adverse effect, right from the purchase and the getting the product. They have a key role to play.
Dr. Abubakar Danraka, consultant, pharmacist consultant, health sociologist, and public analyst. I would like to thank you so much, so very much, for your very robust take on this issue. This is a critical issue. We would continue to have this conversation. It's also just like life. It's a going concern as well. So from time to time, we will bring you into the studio to get your perspective on these issues as they evolve. Thank you so much. And do please have a wonderful holiday for the rest of the time you have to spend there in Cairo, Egypt. I hope you have a wonderful and quality holiday. And then when you return, we can begin to maybe tax you some more. Not sap you of the small energy that you've gleaned and gained, though, but we would also, take some of that as well. Thank you so much for joining us on Insight.
Thank you very much. It's a pleasure to be here. Thank you.